Thank you, Mandy, and thank you to the ICS. These are my disclosures. So rationing, we'll start with the definition. It's a controlled distribution of scarce resources, goods, services, or an artificial restriction of demand. Of course, rationing is not a new concept for all of us, but I'm sure particularly for those of you in countries that have systems such as NHS. So rationing healthcare is occurring in most sectors, and in this area of continence management, there's variable experiences of rationing of continence products. The availability and use of continence pads and products is central to living well with incontinence, and so rationing is in conflict with the principle of equity and can hinder people living well with incontinence. Of course, those of us in the audience will know that there's best practice recommendations for using incontinence products. There are now, I think I found 3 major guidelines. So guidelines from ACA, from the ICI, and also the Wound Ostomy Continence Nursing Society in the States. And all of those guidelines converge with the key recommendation that there is no one product that meets every need, and that users of products need to seek out a variety of products when engaging in different activities. But this creates a dilemma then in terms of trying to determine what's the best product and matching it to the types of incontinence and the severity of incontinence. And that becomes a challenge that's even bigger when it is a case of having to choose a product for another person. So when you're a carer, whether it be a family member carer or a formal paid carer. So the evidence in this area is somewhat limited, but the particular topic that problem, as I said, is that we have organisational rationing of incontinence, continence pads and products occurring in hospitals and nursing homes in some countries, and this may well vary. And that rationing also includes, in some cases, overuse of products, underuse and indiscriminate use. So there's poor selection of products occurring. For instance, 92% of people living in nursing homes use incontinence products. Now, we actually don't know if that's overuse. It sounds like it to me, but there's no publicly accessible data to indicate whether those products are being selected and used appropriately. So the limited research that's been done in this area, mostly is from the UK. This is a big national audit that was done some years ago. I don't think it's been updated, is that right?
No.
No? Okay, so this is from 2008, and it was a very big audit. And when we look at the distribution and use of pads and products in the UK, then the median use of products was 4 times a day, four products a day. And then we've got a study which was a qualitative study conducted by Kathy Murphy, and she found that in 10 people, the pads didn't meet their needs, and again, they were rationed to 3 pads a day. And the choice that people had in their products was very narrow, and potential negative impacts on people's health, independence and dignity. There's also poor correlation, evidence of poor correlation between product use and incontinence and inappropriate use. So some years ago I did a study in an aged care rehabilitation setting called subacute, and this was like a survey of 447 inpatients, and of that group, 41% were using a product who hadn't had urinary or fecal incontinence in the preceding 24 hours. And a similar sort of finding from Norway, there was a study in a nursing home sector, 6 nursing homes, and of 153 residents, 118 were using pads and had a wide range of urinary volumes which didn't correlate with the their use of product. And they also, this is a really important study because this is, I think, the only study we've had that shows the association with an increased risk of urinary tract infection with pad use. And more recently, there's a study from Hong Kong that was done in acute care and found that 46% of inpatients using what they called a diaper had not used it before admission. We have, not in addition to that evidence, we have a lot of discussion and anecdotal evidence of rationing to 3 pads a day. I don't have any idea where that policy or implicit practice came from, and I think that's probably an issue for discussion, how that gets translated. And so there's probably a lot of variation within and between countries. And it raises the question for me of, well, who decides about product purchase, selection, use, and how they're used, particularly in organisational settings? So we do have some, more recently, Murphy et al. Developed these standards for the provision of continence pads, which has been published, and so that's in addition to our ICS guidelines and other guidelines. So my key questions for you and discussion are, do you think there's an overuse of absorbent products? Do you think that some people are being provided with insufficient products? How widespread is this problem? And if it is occurring, how do you think we should go about tackling it?
Thanks very much, Joan. I certainly think in terms of overuse of products, we did one of our studies where we did a lot of collecting in of pads in nursing homes to weigh them and find out the volumes that were in them. That we had a very large proportion, I can't remember exactly how many, but we actually had none, which would completely support what you say. So we have a lot of patients, particularly in perhaps in organisations who are using pads who may not need them at all. And then this rationing of pads, on the other hand, particularly perhaps in the community, of people who do need them desperately. So it's it's one. So I think perhaps my first question, Joan, is how much do you think we should worry about this this overuse, that putting people in pads when they in a nursing home?
Well, I think obviously it's a huge problem that we are. I think there's an over-reliance on incontinence products, particularly in nursing homes, to manage people's bladder and bowel elimination needs, and that many of these people could otherwise be continent if we provide them with toileting assistance. But, you know, in interviews with staff, they talk about using products because it helps them to, you know, they're making pragmatic decisions about staffing and how they can best contain incontinence and manage the problem. Is that the case for other people in other countries?
I think we've got Veronica coming down.
Hi, Veronica from London in the UK. I think, yes, that's a very common situation, and certainly I find working in the community that we've got a real balance between patients who actually have bladder dysfunction and need products, and patients who are frail, who can't mobilise independently, who have a social care package that maybe at the maximum goes in 4 times a day, but they can't get to the toilet without that help, but they're living at home with no other help. So pads, like you say, are then used to manage their elimination needs. And then you then get into the whole debate about, hang on a minute, is this a health need or is this a social care need? And who should pay for it? Should it be health or social care budgets? And you have carers going in, and they go in, as I said, up to sort of 3 or 4 times a day, expect to change a pad every single time they go in, whether it's needed or not. So I think it is a very difficult one, and I think there's a lot of overuse. On the other end of the spectrum, I've got an awful lot of young women in their 30s having our smallest pad, who could probably be treated, but actually would choose to wear a pad rather than to be treated. And when I look at my budget and where we spend the most amount of our money, it's actually on our 2 smallest products. So I'm spending a lot of money on people who I believe we could treat and not need to spend the money on the products, which I could then use to spend on people with significant disability or bladder dysfunction who need more than 4 products a day or 3 products a day.
I'm interested too in your thoughts about, how we can tackle this. And one of my thoughts is perhaps the pad manufacturers have a central role to play here, don't they? And, in my country at least, they're the main providers of education about incontinence in nursing homes. So the messages they impart are very powerful, and I think they employ a lot of nurses who are promoting continence and going in there trying to get appropriate use of products. But perhaps we could team up a little bit more with these companies so that we could send out some consistent messaging.
Certainly some companies are very strong in this, but others much less so. So I think we would like to see more education to have more appropriate use. I'd just like to suggest one thing, is if we know that reusable products are less good for absorbance, the materials are not as absorbent, but actually if you have a lot of people using those products who are not going to get them wet, is there a case for introducing them in a more widespread way? What would you say?
I think it comes down to personal preference, really. And this is where the website's so important, because you're making people aware that there is a range of products available that they otherwise might not have known about. There's still some issues, aren't there, with washing the product, and we have problems and concerns about the environment in terms of the disposables, but equally there's some drawbacks with washables.